So my task this morning is to kind of show you how we open images, how we zoom in, zoom out, manipulate, move things, draw things. We'll do that in a couple of the other functions that are within TraumaCad, not the deformity module. That way, once we get in and we start talking about LDFA, ACA, CORA, and all that kind of stuff, you'll at least know how to manipulate the images and move them around. If you're already in TraumaCad, it'll be up for you. If not, there's the TraumaCad icon. That's the old Voyant logo. When you double click on that, it'll open TraumaCad and launch you into the program. So this is the listing of our patients here, and this is how we would identify which patient, which image we're going to use. This is the stuff that can talk with your PAC system and bring up your images. Again, the folks from Brain Lab would have to explain that to you. The first case that we're going to go to, if you sort everything by last name, under fracture tibia, if you double click that image, it'll bring up the AP and the lateral of your tibia. Again, that's under last name is fracture, first name is tibia. Then we'll single click on our AP and single click on our lateral, and that'll open those images side by side. Once you have your images open, you can click the next button in the bottom left-hand corner, and that'll allow you to select the procedure. For this one, we'll choose the trauma module. As you can see, there's pediatric modules, deformity, spine, foot and ankle, many other things. So once we get to this point, what it asks us to do is to define our views. The computer doesn't know that it's an AP image. All it knows is it's an X-ray. And so we need to define our views. So we say that this is an AP of the right side. And then it wants you to calibrate the image. So it's very important for image calibration. As you can see on this, there's no marker ball because this is a fracture case. It's not one of our deformity cases. So when you don't have a marker ball, what you can do is manually oversize. So if you go to oversize and then select a number like 110, 112, somewhere in there. So the reason it's 110, 112 is because that tibia is sitting closer to the beam from the image source than the plate is, so it relatively magnifies it a little bit. 112, 108, somewhere around in there is what all like total joint templates, if you look at just the pieces of plastic, the overhead projector looking things, they all have an oversize on them, and they're usually around 110, 112. Once you accept that, you have to do the same thing in the lateral view. Again, defining it as a lateral, it's a right tibia. I'm oversizing it, and I'll oversize it to the same thing. And then that brings us to the little skeleton man. Within TraumaCad, there is somewhere over 400,000 implants or something ridiculous. They're all based on the CAD drawings that the machines use to design the implants, so they're very accurate. The skeleton man allows you to limit your view to within things that would apply. So I'll click on his right diaphyseal tibia, and that will just limit my implants. So now we're actually within the program here. To manipulate the images, if you roll the scroll ball, it will zoom in. If you roll the zoom ball back, it'll scroll back out. When you're zoomed in, if you click and hold on the scroll ball, it'll allow you to pan around, release, and you get back out. If you're ever zoomed in and completely lost, up at the top, there's a little blue button with the crosshairs on it that says Fit to Screen. If you click that button, it'll bring you all the way back out to the full zoomed out image. Additionally, if you wanted to work more directly with the one image, if you double click on an image, it will bring that up to the full screen. Double click again, and it'll back you back out. Within TraumaCad, there are many different tools that you can use. For instance, you have the ruler function, which will tell you the distance between 2 points. If you want to delete an object, right-click, delete selected object, and it goes away. You also have an angle tool, which will allow you to measure angles. An inner line tool, which will allow you to measure angles as well, for like Cobb angles or something like that. So there are many different measurement tools that you can use, just like you could on a regular PAC system. Now where we move away from regular typical things, you have this lasso in the corner. This is called define fragment. Dr. Siddiqui, when he's talking about his things later, he uses the define fragment tool a whole lot. You click on that, and what it'll allow you to do is outline one of your fragments. And now I can manipulate and move this fragment around. I can align the fragment just like if I were reducing a fracture. And I say that looks like a tibia. I'm happy with that reduction. The orange handle that hangs off the side, that allows you to rotate. The red circle with the dot in the middle, that is your hinge, basically, your thumbtack. So you can move that to wherever you want, and it'll hinge on different places. Once I decide I'm happy with that position, I can come over and do the same thing in the lateral view. Define fragment, outline my fracture, manipulate it so that I get my reduction where I want it. I'm happy with where I am now, so I say, okay, now I've got my reduced fracture. If you come to the left-hand side, you can click on templates, and you can bring up all kinds of different implants. I'll just use the Synthes nail. Feel free to use whoever you want. There's tons of implants in here. You use whatever you're comfortable with. If you choose find the implant that you want on the left-hand side, you can double-click, and magically a nail appears. You can now position that nail where you want it. Grab the yellow handle to swing it around. You'll notice in the lateral view, the nail is backwards. Up here at the top, there's a little picture of an implant with a mirror next to it. If you click that, it'll flip the implant around so that it's pointing in a more appropriate position. Again, you can line it up. If you need to fine-tune the rotation, you'll notice that it's really hard to control this nail from this point. It swings a lot. If you hold down the control key and drag it, it'll allow you to have much more fine control. Once you've got your nail in there, you say, wait, that nail's too short. I can choose a slightly longer nail. Check my position. Okay, that's probably about what I would want. So once we're done with that, we'll show you how the hip templating works. Again, it's just some different tools that exist within the software. Up at the top, you'll see where it says New Case. It's next to the binoculars. It's the little white piece of paper. Click there. Say OK. It's just asking you haven't saved your images. And that'll bring you all the way back out here to the front. Again, if you need to back out to the front, it's this button here that says New Case. All right, so the next case that we're going to work on is a templating for a total hip. We'll use Kingmark Case 4. Last name is Kingmark. First name is Case 4. And again, if you double-click that image, it'll bring up the AP pelvis. Again, that's Kingmark Case number 4. Click on the image, and this time we'll select hip. And it'll automatically bring us into the hip module. Again, you'll notice we have to define our view. So we have to say it's an AP, and we're going to be treating the left hip because that's the arthritic side in this case. You'll notice under calibration, it says Kingmark calibration device automatically detected. The Kingmark is this series of bars and balls. The software knows how far apart the bars are in real time, or in real space, and how far apart the balls are. What happens is the patient sits on a plate with the bars posterior to them, the balls sit anterior to them, And the software averages those two magnification to center the pelvis within that. If you notice, this is an obese patient, so they hang off the cassette in all planes. So there's nowhere you could put a marker ball that would be in the correct plane other than between their legs, which is not a pleasant place to put a marker ball. So the king mark makes it much easier to get an accurate calibration. Once you click accept, you'll notice down in the corner it says image not calibrated. Once you click accept, it'll automatically calibrate to king mark. And for this one, it calibrated to oversized 115%. Or 113 once it's all the way done. Again, you just go over to there's lots of tools that you can use. If you're in the measurement tools, you can use a limb length discrepancy. So you click on the leg length discrepancy tool, and it automatically finds the ischial tuberosities, the center of lesser trochanters, and it'll show you that the left leg is 4 centimeters shorter, or 4 millimeters shorter, rather. If you don't want that, you can right-click and make it go away. Again, just like before, you can go to templates, and you can choose whatever hip manufacturer you want. There's lots of choices. Choose whoever you want. I'll choose DePuy. I'm going to go ahead and put the cup in first. That's just my workflow. It's what I prefer to do. So I choose the cup that I want. I'm going to choose Pinnacle Acetabular cup on here. Again, I have no interest. I don't use DePuy hips currently, but that's. When you double click, it'll try to find where it thinks the cup should go. It does a pretty good job. You can decide how big. You can say, okay, that cup is obviously not quite big enough. We need something a little bigger. So let's maybe take a 54. That's set at about 45 degrees of abduction. I want to bring it down a little bit and put it about 40. If I wanted to be more precise about measuring, I could use something like the interline tool. Come in and actually tell me just how much abduction do I really have. So here I'm right about that 40 degrees that I like. Once I decide that I'm happy with my cup position, I can come back over and choose a stem. So back to the template side, type of implant, stem, and choose whatever you want to use. I'll just use a Summit press fit. Again, it'll try to figure out where it's supposed to go. It does a relatively good job. Gets it into the ballpark. This line here, so if you're, let me put my hip back. So if you hover over kind of the bottom right side of the image, you'll get the white box that highlights. That's where it's going to cut the bone. I don't want to cut quite that low. That's kind of a ridiculously low neck cut. So I can click on that box and I can adjust that neck cut up a little bit, about to where I would want my normal neck cut. Then I can click back on the stem and I can move that stem around in space where I want it to go. So I can say, I think that looks good there. Probably needs to be a little bit bigger so I get a nice fill in my proximal canal. Say, okay, I'm happy there. The box above tells me what all my changes are. So I'm going to add 6 millimeters of leg length, and I'm not going to change the offset at all on this. So right now, his left leg is 4 millimeters shorter, so if I put this in, I'm going to make him 2 millimeters long on that side. If I'm not happy with that, I can sink that down a little bit more. And now I can get him to that 4 millimeters where I want him. So that's, if I make that neck cut with a stem in that position, that's how much I'm going to change. Once you're happy with it, if you right-click on the stem and say attach to cup, it'll perform a neck cut and it'll attach the tip of the stem to the center of rotation of that cup. And so now you can see it looks like a hip would work and how it works. Then it will allow you to play with your offset and your neck length. So if I wanted to go high offset, that's where I would end up. So I add a bunch of offset. I could add a whole bunch of length. And it'll tell you all of that, how much you're changing things. Once you decide, I'm happy with this, this is what I wanted to use, left-hand side, go to Report. Show Report. And it will bring up what you've just done. Pre-op image, post-op image, what implants you used, Pinnacle Cup, 54, Summit Press Fit, size 3, 1.5 neck length. Here's your hip pre-op and post-op. I'll show you all of that. So you could send this to your OR or something along those lines. So I apologize if I kind of rush through things as we go, but we're here for deformity, not for hip templating. But this at least gets us used to clicking and moving around the program before we start talking about some of the new words and slogans while Sean brings up his stuff. Questions about anything relating to anything I've showed you so far? All right, so if you click on the new case, we'll back all the way out and we'll let Sean get started with the deformity side of things. Thank you all.